Hello, everybody. Today, we would like to share our research topic association between systemic immune-inflammatory indices and severity of coronary artery lesions in patients with coronary artery disease in different glucose metabolic states. Is a chronic heart disease caused by coronary artery stenosis, which has become a major public health problem with increasing morbidity and mortality worldwide. Diabetes mellitus (DM) and abnormal glucose metabolism are important risk factors for Canadian dollar and are closely associated with the development and progression of coronary artery lesions. Inflammation plays an important role in the development and progression of atherosclerotic coronary artery disease. Patients with diabetes or prediabetes are often accompanied by an immune-inflammatory response, which may be closely related to the severity of coronary artery lesions. Therefore, the aim of this study was to investigate the relationship between SII and the severity of coronary artery lesions in different glucose metabolic states. Patients with Xiandu were enrolled between January 2018 and April 2022 due to typical symptoms of chest tightness and chest pain who subsequently underwent coronary angiography. Participants were included and divided into four groups based on quartiles of SII values. Q1 SII is less than or equal to 351.5 to Q to 300 and 51.5 to SII is less than or equal to 485.7. 7Q3 485.77 SII is less than or equal to 682.86 Q for SII is more than 682.86. The primary outcome of this study was to observe the relationship between SII and the severity of coronary artery lesions in Canadian dollar patients with different glucose metabolic states. The main findings of this study can be summarized as follows: a significant positive correlation between SII and the severity of coronary artery lesions was observed, with higher SII associated with more severe coronary artery lesions. The relationship between SII and the severity of coronary artery lesions across different glucose metabolic states, without adjusting for confounders. The correlation between SII and the severity of coronary artery lesions was significant in all glucose metabolic states. After adjusting for confounders, a significant correlation remained in patients with diabetes DM and prediabetes PREDM, but not in those with normal glucose regulation (NGR). Subgroup analysis confirmed the robustness of this association, showing consistency across different populations. A linear relationship between SII and the severity of coronary artery lesions was found, with each unit increase in SII corresponding to a 41.6% increase in the severity of coronary artery lesions. SII has a significant relationship with the severity of coronary artery disease, even in different states of glucose metabolism. SII remains correlated with the severity of coronary artery disease. Therefore, SII has potential application as a combined evaluation tool in clinical practice, providing a new perspective of individualized diagnostic and treatment strategies for coronary artery disease patients with abnormal glucose metabolism. Thank you for attention.